Hello, and welcome to the People Power Lunch Hour show here at PhillyCam. I'm your host, Vanessa Maria Graber, and on today's show, we're going to speak with members who are advocating for the LGBT community here in Philadelphia, talking about long-term care and other issues that are important to them. I have a variety of guests working here in the community. We're going to have a great discussion and talk about resources that are available to you. We're broadcasting live on WPPM LP in Philadelphia and also on PhillyCam TV. Stay tuned. We'll be right back to talk about all that and more on this episode of the People Power Lunch Hour Show. Hello, welcome back to the People Power Lunch Hour show. Again, I'm your host, Vanessa Maria Graber, and I am honored to have with me in the studio a variety of people here in Philadelphia doing very important work, advocating for our LGBT community, equal rights, and fair treatment. We're going to talk about long-term care, housing, and many other issues that are affecting them. In the studio, I'm joined by Gigi Nikpour, who's on the PhillyCam Board of Directors. She also works with Community Legal Services and serves on the Human Relations Commission of the Mayor's Office. I also have Dawn Munrou, who's a biologist, social activist, who's active in the Gay Liberation Front. She also serves on the board of LGBT Elder Care Initiative, and she is committed to assuring that the LGBT older adults have rights, opportunities to their lives. I also have here with me Terri Clark, who is the Prevention Services Coordinator at Action Wellness and also works with SAGE, and also Pam Walz, who's the Supervising Attorney with Community Legal Services, Co-Director of its Aging and Disabilities Unit. Thanks for joining us on the show.
Thank you. Good to be here. Thanks, Vanessa.
I wanted to start with Dawn Munrou, who has a really great story to tell. And she's here as an activist who is a voice for this community and has a lot of insight and has written many statements telling her story. Can you talk about some of the issues that you'd like to highlight in regards to the LGBT Elder Initiative?
Thank you. I won't talk specifically about the Elder Initiative because there are many other organizations which play a role in this also. I serve on also the Philly Police Commissioners LGBT Liaison Committee. I work with Sisterly Love and TPAC, and I serve on the Mazzoni Center's Consumer Advisory Board. And through this work, I meet people all the time who come from very diverse backgrounds. They may be black, they may be white, they may be anything with under the sun from the LGBT community. And one of the things that they always tell me as they get older is they talk about the difficulties they anticipate facing as they get really old. I live in the Anderson apartments, and people there are pretty well encouraged to, when they need help, to have help provided at home so they don't have to go into care. But inevitably for some there comes a time when it's necessary for them to do so. And just to give you an idea of how things are, I know of 2 elderly women who were asked to leave the facility that they were in because they were regarded as being disruptive. Now, they were being disruptive just by virtue of who they are, not because of anything they were doing. And in some occasions, the care staff did nothing to respond to the homophobia that these patients received from other patients in the same facility. there was something else I was going to add to that, and now I forgot. Oh yeah, I mean, I had a friend who died about 5 or 6 years ago, and who was in the hospice, and got moved out of the hospice. They simply phoned up and said, take her away. Went into another hospice and had the same result, and she ended up dying at home in really tragic circumstances. Now, that's not the sort of thing that you expect your last couple of years to be like.
Thank you so much for sharing that. I'm just going to read a quote that was issued in the new ARP survey that says, when it comes to aging-related concerns, older LGBT individuals worry most about having adequate family and other social support to rely on as they age, discrimination in long-term care facilities, and access to LGBT-sensitive services for seniors. Also, Black and Latino LGBT adults report the greatest concern about future family and social supports, and a greater number worry about potential abuse in long-term care facilities because of their race, ethnicity, and their sexual orientation or gender identity. And so that's basically what we're here to talk about today. And recent estimates suggest that there are at least 1.5 million lesbian, gay, bisexual people 65 and older in the United States. And this population will double by the year 2030, according to the UCLA Williams Institute on Sexual Orientation and the Law. So Gigi, who's also here, I just wanted to talk about May and June as being months where we take time to talk about these issues, and maybe tell our viewers why this is an important issue to bring to PhillyCam and to our viewers.
Thank you, Vanessa. So I think May is an important month. It's known as the Older American Month. And June, again, is an important month because it's Pride Month. And both of these months are back to back. And I think it's important for us to take some time and address the issues that are really important and are impacting the LGBT community all over the United States. But, we're going to concentrate on Philadelphia because this is where we live. And, being an activist in this field, being a commissioner with the mayor's office, and, doing some work about LGBT rights internationally myself, I think it's really important that, locally we address some of the shortcomings, and hopefully with the experts we have here, they can go a little bit more into the depth of the issues that are unique here in Philadelphia.
So I'm going to pass this off to Pam in just a moment, who is your colleague at Community Legal Services. Can you talk about some of the people that have come to your organization? What are some of the incidents or experiences that some of the clients are facing? Basically give an overview of what people are coming to you for help with.
Hi, thanks. So again, I work at Community Legal Services in our Aging and Disabilities Unit, where we represent older adults and people with disabilities. And a lot of the work that we do focuses on the rights of people who need long-term services and supports. And as you were saying, there have been a number of studies that show that LGBT older adults worry that they will not be treated, that they will be treated differently if they have to go into a long-term care facility. And in fact, people worry about whether or not they will need to go back into the closet, which is just really a tragic way for someone's life to evolve after, we've had decades of progress in this area. There also have been studies that have shown that, in fact, some staff do react more negatively to LGBT individuals and to same-sex couples, and that comes from attitudes that they learned in growing up themselves, and the long history of homophobia in this country and everywhere. I want to talk about a few protections that do exist in nursing facilities that are important to know about. There's federal law that sets out very detailed rights that nursing facility residents have. And some of the more recent changes to the law actually directly speak to the situation of LGBT older adults. Residents in nursing facilities have a sort of a very general right that's very important, though, and fundamental to a dignified existence, and to live to be treated and provided with care in a way and in an environment that enhances their quality of life and with respect to their individuality. And so nursing facilities have an obligation to support residents and to treat them with dignity and respect in the care they receive, in their interactions with staff, to protect them in their interactions with other people who may come into the facility or who may live in the facility. Residents also have the right to be free of discrimination from a facility, and they're entitled to support in exercising their rights. And then there's some more specific rights. Residents have the right to designate a representative. If they're not going to be able to speak for themselves at some point, they can designate someone else to speak for them through a power of attorney or some other legal document. And the regulations now are specific that can include a same-sex spouse, for instance. And that's something I think has been an issue in the past. I think one of the things that we've heard about has been stories of LGBT individuals going into hospitals or long-term care facilities and having difficulty getting the staff there to recognize their partner as their decision maker or someone who should be able to receive information about their care. Residents have the right to receive care through what's called a person-centered planning process, where all the professionals that are involved in figuring out the kinds of care the person needs sit down together and figure out what are all the aspects of care the person needs. And the resident has the right to choose other people to have there, family members, friends, people who can help them articulate what their needs are and who can add to that. And that can include, explicitly now in the regulations, a same-sex spouse. It can include a friend, anyone the person wants to have there. And that person gets to participate in that process as a support to the resident. And then there are regulations about access and visitation, which has also been an issue historically in nursing facilities. And the regulations are now explicit that among the people who have the right to immediate access to visit people in a nursing facility are spouses, including same-sex spouses. And so this is subject, of course, to the resident's right to withdraw that. So it's up to the resident whether they want the person. But if they do, same-sex spouses stand on an equal footing with heterosexual spouses in terms of the right to have immediate access and to visit at any time, as of course it should be.
Thank you. It's good to know your rights. And I think that's the problem. A lot of people are unaware of the rights that they're entitled to. So we thank you for the work you do at Community Legal Services, letting people know. I wanted to speak with Terri, who's the Prevention Services Coordinator at Action Wellness and also works with SAGE, which you're going to tell us all about.
Thanks, Vanessa. So my work at Action Wellness is I oversee prevention services there, and we work with folks who are at risk of HIV and also long-term survivors of HIV. And I think when we talk about the needs of our LGBT older adults, there are folks who are long-term survivors living with HIV who are now into their 50s, into their 60s, into their 70s that are a part of this LGBT community. And we know certainly not everybody living with HIV is part of LGBT folks, but that there are a number of folks. And so our agency serves not only folks living with HIV, but people with chronic illness. And now HIV is considered a chronic illness because people are living longer and living quite healthily due to the medications. So my role there really involves me in the community. We do work over at John C. Anderson. We provide medical case management services and education services for the folks over at John C. Anderson, which for those of you who don't know, is Philadelphia's first and only LGBT-friendly, affordable senior housing. So we're very proud of that in Philadelphia, and not many cities in the country have similar housing. So Philly is leading the way on that. And then my work with SAGE. So SAGE is Services and Advocacy for GLBT Elders, and it's a national organization with affiliates across the country. And the affiliate here in Philadelphia is at the William Way Community Center, which is our LGBT center, located over on Spruce Street. And part of their programming is to reach out and include LGBT older adults in the community. And so SAGE also has an affiliate in Pittsburgh. But the other work of SAGE is not only to advocate on a national level for the things that we're talking about today in terms of the Older Americans Act, in terms of services and supports available, but to also provide technical assistance and resources, including training. So I've been fortunate to work with the community throughout Philadelphia and Pennsylvania to bolster long-term care services in their ability to serve LGBT older adults, their families, their friends, their community with dignity and respect. And I know we're going to talk more about training in a future broadcast, but that's my role with SAGE is a certified trainer, and happy to speak more about that work.
Thank you. That's a really great resource for people to know about. We've had folks from William Way come on to People Power Lunch Hour, so they do really great work in the community as well. I wanted to talk about access to health care as well, more broadly, because you mentioned that many of the people that you serve have HIV and they're survivors. And so one of the other things I have here is that, LGBT older people deal with significant health disparities across areas related to physical and mental health, including high blood pressure, cholesterol, diabetes, heart disease, HIV/AIDS, and serious mental health issues. According to a 2011 National Health Study, more than half of the respondents have been told by a doctor that they have depression. And 39% have seriously thought of suicide, and 53% feel isolated from others, which is another issue, social isolation. Dawn, I'd like to ask you about that. If you felt as though you did not have significant access to health care, or have seen others struggle with that, and if you have felt social isolation.
Simple answer to all of those questions or comments was yes. One of the things that really disturbs me are when youngsters feel so isolated, so left on their own, that they opt for what they see as being their only solution, and that is suicide. And I had a friend who committed suicide a year ago at the grand old age of 19. Think about it. What could this girl have been in 20 years' time? She was terribly smart, but she hadn't been able to go to college. If you think of the number of people we lose this way across the country, and it's particularly prevalent amongst older people, it should not happen in a civilized society. We all ought to see each other as being part of this one great big human family, but sadly we don't get to do that. I've had problems, well, not any time recently, but certainly within the last 10, 15 years, of being treated somewhat cavalier approach in some hospitals and clinics. There are, believe it or not, hospitals in Philadelphia which won't accept LGBT people. They find a quick reason to ship them out to a different facility. That again is horrendous. Many of the people who are activists today were activists, 40, 50, 60 years ago. And to end their lives being treated this way really takes them back to being the second-class citizens, which is how they were viewed before we got the various benefits and the legislation to support people that has come out in the last 10, 15 years, where an awful lot of progress had been made. But no, they still have a long, long way to go.
Thank you for sharing that. Pam, I wanted to ask you about older individuals who might be suffering from Alzheimer's or dementia or are very sick. And have you seen cases of neglect or people that are not receiving adequate care because they've been isolated from their families, from being LGBT individuals?
I mean, certainly, people who have dementia are at risk of not getting all of the care that they need, and we also know that LGBT people are statistically less likely to have involved family. So they're more likely to be isolated. They're less likely to have connections with their children even. And then as people get older, they start to outlive their friends who've been their sort of family of choice, or those people may also be having difficulty taking care of their own needs and may not be able to take care of them. And so we do hear from, sometimes we'll hear from community members or friends who are calling us about someone they know from the community who is struggling and doesn't have family to help support them. And so sometimes the community will come together and try to find resources to support that person. And there are many organizations in Philadelphia that can help people access those resources. One of them being, our office, Community Legal Services. We help connect people, explain the different programs that exist, and connect people to them through the Area Agency on Aging, the Philadelphia Corporation for Aging. There are many services available to older adults, and if people go on their website or call their helpline, they can get information about a lot of programs, both to provide different kinds of services to people in their own homes, and also information about facilities. Another really important resource that I should mention is the Long-Term Care Ombudsman Program. So the Older Americans Act mandates that there be ombudsmen, which is a Swedish word for citizen advocates, and long-term care ombudsmen are available in every part of the country to help residents of long-term care facilities, nursing homes, other kinds of facilities, who are experiencing poor quality of care or are having problems in terms of having their rights respected. There are posters in long-term care facilities telling people how to contact the ombudsman, and the ombudsman will come and will listen to the problem, advocate with the facility, make a report to a licensing agency if needed, and they can be a really wonderful support for people in long-term care facilities.
Thank you. I see you nodding in agreement. So if you just wanted to add to that.
Vanessa, you're so perceptive. So yes, I was thinking about the Ombudsman program, and here in Philadelphia, CARI, the Center for Advocacy and Rights and Interests of the Elderly, is another great resource. And they, along with PCA and Center in the Park, a senior center in Germantown, oversee the Ombudsman programs here in Philadelphia. And SAGE is working with the state-level Ombudsman program to help their volunteer ombudsmen become more aware of the needs of our LGBT older adults, and I'll be presenting at the Ombudsman Conference in a couple of weeks about those unique needs of our LGBT older adults. So training is happening at many different levels. PCA, but the Philadelphia Corporation for Aging that Pam had mentioned, has undergone training. So I think our community who's listening or viewing today, and they hear a resource mentioned, whether that be CARI or PCA or CLS, William Way, right? These are all friendly and welcoming resources that people should really feel that they can reach out to, and that they will be served with dignity and respect. And I just want to take a minute to talk about some of the things that people say, you know, when I'm out in the community and they say, well, you know, we treat everybody the same, or what's so different about LGBT older adults? And I summarize that in three points. Number one is that these communities, right, and we have diversity within this community, right, with our race and our ethnicity and between the G and the L and the B and the T, that they've lived a lifetime of discrimination. And so therefore that makes many fearful of accessing long-term care services. It makes them fearful of accessing aging services, right? So when you're living a lifetime of discrimination, stigma, that also contributes to those health disparities that you had mentioned earlier, Vanessa. The next point is that they rely on families of choice, or their logical families. So when Pam was talking about family being able to come in, and that's protected by residents' rights, that's really a huge step, that a same-sex spouse or partner or sweetheart would be able to come and visit that person, because legally they may not be defined as family. Right? So we do have, for now, we have federal marriage. Not every person wants to get married, can get married, but you know, if they are legally married, that protection is there. But family needs to be broadly defined, not just in sort of that legal heterosexist kind of mindset. So if there is a close friend that a gay person considers family, that they would receive those same protections under family, right? So our LGBT community relies on those families of choice. Their biological family oftentimes will, just kick them to the curb, or they don't want anything to do with their gay family. And, I think if we all think back to our own families, we all have gay relatives, and how we treated them and how they were welcomed at holidays or not is really illustrative of what happens in the larger society. And that third area is unequal protection under laws and policies. And we are making gains in that. But here in Pennsylvania is a perfect example that we have federal level marriage, but in Pennsylvania we do not have a statewide non-discrimination policy. So in the state, a couple could get married and then the next day be fired from their job or lose their housing because of their partner is the same sex. Now in Philadelphia and other municipalities, we have those protections, but we don't have a statewide protection. So there's still a lot of inequality in under laws and protections. So those three areas, lifetime of discrimination, reliance on families of choice, and unequal treatment under laws and policies are really what sets aside our LGBT older adults and the reasons that we need to have more advocacy and have targeted outreach and programs that really kind of learn about those unique needs.
Thank you. You all are a wealth of resources today. If you're just tuning in, I'm Vanessa Maria Graber, and this is the People Power Lunch Hour Show here on Philly Camp TV on WPPM. We're talking about issues that affect older LGBT adults in long-term care and housing, and also just about resources that they can tap into here in the community and knowing what rights that they're entitled to. I want to go to Gigi again to kind of talk about some of the other issues that we should be highlighting in this conversation, because this is a long-term conversation. We're going to be talking again later on in the month. But, you are involved with the mayor's office and you serve on a commission. How do some of these issues relate to some of the wider issues that we're also dealing with here in Philadelphia?
Thank you, Vanessa. So, the Mayor's Commission is very active. We cover all different areas, youth, other diversity issues, and, the elderly issue is another one. I think this commission is one of the most active of all the previous commissions. And we are trying to handle and address some of the, basically, I would say, challenges that maybe the office inherited, the new commission inherited. So I would see that our work is showing its impact, and it's a very active commission. As far as my area of interest, which is basically the elders. I feel that we've come a long way, and we'll continue to push for some of the gains we need to have, the issues that basically Terri lined up. I believe that it's important that now that we're in 2018 and 2020 is right around the corner, and we know that the demographics of elderly population is on the rise and is going to continue to rise in United States. It is important as an urban city that Philadelphia starts addressing some of these shortcomings and be proactive to get a handle on the issues so that we do not have a catastrophe or a bad incident and then be caught in the middle of it. Okay, so for me, that's my goal, really, is to be proactive and to address the problems and address the needs of people who are suffering right now. Dawn is a friend, and her needs to be addressed.
Thank you for your service to the city, and serving on this commission. It's really important that we have diversity and equity, right? Being able to serve in these leadership roles. Dawn, and inclusion. Hold on. Let me pass you the mic in just 1 second. I just wanted to say that studies show that many trans people age faster than their non-trans counterparts, and that they also are more likely to have experienced rejection by their families. Trans people, especially older adults, are among the most invisible, marginalized, and vulnerable members of society. And I think by that, some people might be able to hide their sexual orientation or not disclose it, whereas some trans people maybe don't have that option. Can you talk about your experience as a trans woman, and then also, like as you mentioned, not just diversity, but inclusion and equity?
Inclusion and diversity mean the same thing. I can best put it as diversity means you get invited to the dance. Inclusion means that when you get there, you might be asked to dance. So, there is a big difference. My experiences growing up were, frankly, horrendous. I was arrested more times than I care to remember. My only crime was being me. I've been the subject of unprovoked violence just for being me. When people get to their latter years, they're not just carrying the kind of load that the normal elderly person carries. They've got the burden of all those years of being discriminated against, losing jobs, losing homes, losing families. And to my way of thinking, this is a community that needs a little bit more care, a little bit more attention. I think it was Terri was talking earlier, or maybe Pam, I can't remember now. It's another thing that happens when you get older. About the loss of family. One of the things I have seen happen regularly is people who have grown up in the same neighbourhood, and over time, many of their friends have moved away, family have moved away or died, and they're left on their own, but now in a neighbourhood where they're no longer welcome. And the response to that most times is just to not go outdoors unless it's absolutely essential, because they fear, sometimes wrongly, but an awful lot of times rightly, as to what awaits them if they do go outside. And that, again, is a terrible way to end up living your life.
Thank you for sharing that. I think it's important for people to understand that the years of discrimination, traumas that it causes, does weigh on people, and it does cause an additional burden, especially as they're looking to retire and enjoy their golden years, right? You are again nodding in agreement. So I'm going to pass the mic back to Don, and then if you'll pass it back over to Pam.
There's something else that is important that hasn't been mentioned here, and that is that your average person, when I say average person, I mean heterosexual, your word, heteronormative. They grow up, they maybe have a family, they have a job, they contribute to a pension plan and all the rest of it. And there comes that beautiful day when they flip the company or the establishment, the board, and, they're done. That doesn't happen for many people within the LGBT community because they've been hounded out of job after job after job. They've been unable to establish any kind of financial resources, and they end up living on whatever is the government's minimum benefit. Last year, I think it was $971.
No, SSI is actually $750 a month.
Oh, sorry, $750 a month. And from that, they have to pay usually a rented room, which is going to cost them about $400. And they've got nothing. They can't pay for cable. I mean, they can't afford the $100 a month or so that's going to cost them. They tend to live in areas where it's not easy for them to travel to big grocery stores like Acme or Superfresh or any of these places, so they end up spending a disproportionate part of their income on basically junk food from the local corner store. I mean, it shouldn't be that way. That was what I'd wanted to get in before we...
Oh, I'm sorry.
No, before we switched over, okay?
I thought of something that I wanted to add about why training in nursing homes is so important, and why having nursing facilities that are LGBT-friendly environments is so important. And that's the nature of the relationship that nursing home residents have to the staff there. They are, the care that is provided to residents of nursing homes is really intimate care. This is staff that is helping the person bathing, dressing, maybe eating. It's very intimate care. It's very physical. It's very close. You're coming into really close contact with people, and so it's really important in that there be respect and dignity in that interaction. And it's especially important for two reasons. One is that the resident is dependent to some degree on the people around them. They're vulnerable. And the second is that for many nursing home residents, the people in the nursing facility are most of the people that they see, that they have their interactions with, that are their company, because they may not have some people don't have many visitors at all, and even if they do, there are many hours of the day that there are the people who work in the nursing facility, and the other residents are really the only people they see. And so that's why it's so important that we develop environments within nursing facilities that are truly friendly and welcoming and comfortable places for LGBT people to be.
Agreed. I think we're touching on cultural competency training, not just on sexual orientation, but on people's culture, their religion, the diversity that really exists here in Philadelphia. Again, I'm going to give you a chance to comment as well, because I feel that your story, some of the things that you touched on, I think really, hit a nerve with some of us, really resonated.
Yes, and in hearing stories like Dawn's, it in a story I'll tell in a brief way, really exemplify what happens when we age. If we're fortunate enough to make it into our 60s and 70s and 80s and 90s and beyond, right? We're all becoming more dependent as we age, and for many of us, we've lived lives as independent people. So that graduation towards becoming more dependent as aging puts us in a more vulnerable spot. And we live in a very ageist society, which is sort of another whole topic, but it overlaps, right? The intersection between ageism and heterosexism and homophobia and racism, it's there. And there was hearing about stories of isolation, and as people move from maybe their home that they've been in with their partner dies, and they go into a long-term care facility. There's a person who lives in Illinois who moved in. She was with identifies as a lesbian, was in a decades long-term relationship with her partner. Her partner died. Marcia ended up moving into a long-term care facility. Long story short, Marcia goes to make new friends at the long-term care facility, right, which is kind of scary for anybody of any age to have to move someplace and make new friends under such, circumstances of grief and loss. And the residents really were not very friendly. They were not very welcoming. And as she shared her life story, as we all do when we're getting to know people and making new relationships, she was treated with discrimination and disrespect and hatred. And the long-term care facility did not step up. They did not stand by Marcia and say that that's not okay, and really kind of ignored the situation, putting it back on Marcia to, say, well, you have to figure this out. It's just, you two have to all get along. So there was a case that ensued, and it's, it's with Lambda Legal, and they're taking it to the next level. But that the story exemplifies that this happens, and that long-term care facilities are responsible for creating environments that are safe, that are welcoming, and that they're inclusive. So in training, and that's what we do, right? And I don't think about cultural competency as an endpoint, and even that word, like, what is cultural competent, right? But we do have measures, we do have criteria, we do have specific things that people can do as a result of the training to help their staff, their residents, the family that's coming into the facility feel welcome and inclusive. And I know we're going to talk more in depth about that, but one of the assumptions that people have when we say, well, maybe we should think about training, or have you ever thought about training? And people say, well, we treat everybody the same. Why do we need training? And I think that's good intention for the most part, that people want to believe that they're treating everybody the same, but do we really? I mean, if we treated everybody the same, we wouldn't have ageism, we wouldn't have racism, we wouldn't have heterosexism, we wouldn't have homophobia, right? We wouldn't have all those isms that we live day to day in this world, that we can see time and time again, every day, all the time. So the intention may not be there to discriminate, although we do see people intentionally treating others poorly, but helping providers understand those unique circumstances and how the training is designed with very learner-centered and that sort of thing. So I'm going to hold those comments for the next show and hopefully have piqued people's interest in learning more about that.
Thank you. And yeah, I think it's also about the providers being responsive. So when these cases come up, they know how to respond and protect somebody like your friend when these incidents come up. Because that's, all fine and well if you provide training, but if they're not defending the residents and making sure that doesn't continue to happen, just like in schools, right? We can have all this anti-bullying training, but if the schools aren't protecting children, it's all for naught. I also want to make a comment to our listeners and viewers out there, because many of us do have grandparents or older friends that are in these facilities and they spend time visiting them. That again, if you see something, say something. I think this is the community part where if you are visiting a relative or a friend and you see somebody who is looking isolated or alone, like say hello. Speak to them, invite them to a conversation. And if you see somebody being mistreated or abused, we have to speak out and defend one another. We can't leave it all to the provider, these corporations to protect us. We have to look out for one another. And so that's my personal call to action to everybody out there. We're all responsible for care and compassion for one another. Oh, I'm sorry. I thought you wanted to say something. Yeah, so we just have a couple minutes left here on People Power Lunch Hour. I want to pass it to Gigi, who's going to talk about our next show. So we're going to continue this conversation and talk more about community solutions, policy, and ways that we can advocate both at the local and state level for our older LGBT adults.
Thank you, Vanessa. So the next conversation that we're going to have is the second segment to this show, and it will be on May 30th. Again, it's a Wednesday from 12 to 1, People Power Lunch Hour. And in that show, we will discuss possible approaches to the existing system and what we would like to recommend as far as what could be some of the solutions to start moving towards a direction where we can protect people's rights and treat them with dignity regardless of their sexual orientation. Thank you.
All right, I want to thank all of our guests. Thank you so much for the work that you do, for advocating, for showing compassion and love to everybody. And you can find more information about the work that Gigi and Pam do at Community Legal Services. If you look them up here, they're in Philadelphia, and you can access their offices in Century City and North Philadelphia now. And then I want to thank Dawn Munrou for the work that she does in Oh, yes, it was a pleasure to speak with you. And Terri Clark, who works with is the Prevention Services Coordinator at Action Wellness and SAGE, which is both a national organization and has a local chapter here at the William Way Center. We'll be back at the end of the month with more information about this issue. Be sure to check out this episode and all of our episodes of the People Power Lunch Hour at phillycam.org and also on our YouTube channel. Thank you so much for watching and listening. We'll see you next week.